Hi, good evening, everyone. My name is Yap from Bagan Specialist Center Marketing Team. Today, I'm glad to invite Ms. Kang from Bagan Specialist Center to give us a sharing on the topic about developmental delays in children. Ms. Kang is a clinical psychologist in Bagan Specialist Center. And without further ado, please welcome our speaker for today, Ms. Kang.
Good evening, everyone. Thank you for joining in this evening on a Saturday night. Hope you all had an enjoyable dinner. So without further ado, I'll go ahead and start today's topic. My name is Ms. Kang. So I'm a clinical psychologist currently based at Bagan Specialist Center. So today we'll be discussing about developmental delays in children. Mainly, we'll talk about, first of all, how do we recognize developmental delays in children? So how will we know whether our child is actually experiencing some delays or not? Then we'll talk about some of the neurodevelopmental disorders whereby developmental delays are part of the main symptoms and what types of disorders are there. And we'll talk about assessments and testing to identify and to diagnose such disorders. And last of all, I'll also talk about very briefly about certain current interventions or treatment that's available for developmental delays at the moment. Okay. So when we're talking about developmental delays, there's actually a few categories, and certain children might experience different types of delays at one time, or some children might be experiencing delays in multiple areas at once. Okay, so the first one, which is the earliest signs, are speech delay. It's the most easily identifiable one. Okay, then we have language delays. Earlier on, it's speech delays, meaning whether the child is able to speak or not. Then when we're talking about language delays, it means whether aside from speaking, apart from the ability to be able to speak and produce sounds from our mouth and using our tongue, and that some children might be experiencing difficulties, for example, organizing their thoughts together in verbal expression, or understanding proper ways to communicate and things like that. We have cognitive delays. This one will be more of our intellectual functioning. Okay. And then physical delays, these are the usual, whether the child has developed the ability to crawl, to walk, to stand, and such. And we have social delays, which are delays in social skills, whether your child is able to interact well with similar to their ages, and whether they are able to interact and play well. And then we also have behavioral delays, whether in terms of behaviors, there are other odd behaviors or inappropriate behaviors that's actually not supposed to be there for their ages. So factors for developmental delays, there are a lot of them. There are a few. There could be genetic factors. That certain children might have a genetic predisposition from, for example, from parents or from other, members of the family or of the extended family. Social factors such as cultural factors, for example. In Malaysia, we generally learn more than one language, so this might be a factor that comes into play as well. And then what happens in our school, okay, what happens in our community, in our environment. So all these are social factors. And of course, there are medical factors. Certain developmental delays might be a manifestation of certain medical conditions. Okay, for example, certain pre-born, a child who is born with epilepsy, for example, okay, which might, in the long run, might affect certain intellectual abilities. And then some might have born to be have hearing difficulties, hearing impairment, or speech impairments. Okay, and then we have parental factors as well. Sometimes developmental delays might be a result of parental neglect or poorer behavioral management, for example. So these are some factors that might contribute to delays. We might not be able to figure out which one exactly is the main cause. It might be several, it might be genetics, it might be also social factors, it might be also parental factors, for example. So unfortunately, a lot of the developmental disorders later on that I'll be talking about, a lot of times the direct causes are still scientifically unknown yet. So for example, genetics might come into play, but whether or not the child really develops that condition, it might differ from individual to individual. Okay. Right. So now we'll talk about the $1 million question. Whether how do I know if my child is delayed? Okay. So technically, developmental delays will mean that when a child does not achieve certain milestones at expected stages, meaning expected chronological ages, okay? And this is especially when these delays are very significant, are very big or very noticeable in one or more areas, okay? So meaning maybe compared to siblings or compared to other children, their ages, the delays is very, very apparent. It's far more slower than other kids. Certain signs to watch out for when a toddler. Okay, response to sounds. This one we might need to test and see whether, for example, if we ring a bell or we place certain toys that will make sound next to your infant or your toddler, whether they respond to that, they will have different reactions to different sounds. Okay? Poor and inconsistent eye contact is very important as well, whether they are actually looking at you when you're pointing to objects in front of them, or when you're talking to them, are they looking at you, or is it inconsistent? Okay. Speech delays, remember this was one of the ones that I've mentioned earlier, that's the clearest one. So watch out if, let's say by 1+ or 2 years old, your child still does not have proper words, does not speak proper words, or maybe even does not babble, there's no nonsense sounds that they're able to verbalize. And then watch out for social interactions. This will kind of also fall in line with the earlier one, which was lack of eye contact. So watch out if they look at you when you're talking to them or when you're playing with them, or also whether they are able to return that interaction. For example, when you say hi or when you wave at them, are they able to do the same thing in return? Are they able to actually return that interaction? Okay, or will they be able to initiate social interactions? Will they want to seek you out to play with? Will they ask you for something, for example? Physical delays, watch out for if by the similar ages around 1+ or 2, whether they are still unable to crawl, stand, walk, or they are exhibiting slightly inappropriate behaviors. For example, if they are still walking on tiptoes by a 2-year-old, for example. Okay, so this is just a bit slightly not so normal, because by the time where children are able to walk properly, they should be able to walk on their heels rather than the tips of their toes. Okay, also watch out and see if they have very clumsy motor coordination. For example, does your child fall down very easily? Are they not able to walk up and down steps and stairs? Are they, are they able to walk in a proper direction when they're supposed to, or will they sway out of the direction, or will they be easily knocking into things, and falling down, or even walking also, do they have difficulties balancing, or do they always fall down, for example, head first when there's a step or something in between. Okay, so these are just some red flags to watch out for, early red flags, early signs. So do not hesitate. If you're concerned and if you're not sure if you need an answer, just seek out or consult your doctor or your pediatrician to just ask about it, whether to see whether you should continue to monitor or should you be concerned. Okay. Right. So I'll just very commonly seen neurodevelopmental disorders. So this means that it will be to an extent where your child's delays are very significant, be causing certain impact in their daily functioning. For example, in their friendships, their relationships, they are not able to even form proper relationships with parents, or it might be affecting their learning and their communications. Okay, so when it becomes a disorder, it means the delay has become a big concern and should maybe warrant further testing and assessment to see whether there are other interventions or treatments or therapies that are needed for the child. Okay? Right. First one I'll be introducing is intellectual disability, or in layman's terms, or in olden terms, are more commonly known as mental retardation. But at this time, a better term to coin that would be intellectual disability. Okay, so a lot of us will think that for someone who has an intellectual disability, it will only be a delay in terms of their thinking or their IQ. That is what we all tend to know lah. Okay, but the thing with intellectual disability is that it doesn't just affect an individual or your child's thinking or your child's cognitive abilities or their learning abilities. It also affects adapting as well. Okay, meaning your life skills. Okay, are you able to take care of yourself, or other the reasoning? Okay, your EQ. Okay, and this will range from mild to moderate to severe to profound. Okay, so milder forms of intellectual disability, the child or the individual might still be able to grow up to function relatively well. They might still be able to sustain jobs. They might still be able to take care of themselves, for example. But they might need certain guidance, more close supervision in terms of work and personal functioning. Okay. Because earlier on we mentioned that intellectual disability also covers, apart from intellectual functioning, and also adaptive functioning. So when we talk about intellectual functioning, it's mainly our ability to reason, to think, to solve problems, to make judgments, to make decisions, to plan for future planning, or for what we are going to do later or tomorrow, and the ability to learn even from basic observation and from experiences. Okay. Adaptive functioning will mainly cover self-care, meaning whether the person is able to shower, to go to the toilet, or the child is able to get certain food for themselves. Okay. Other daily activities, independent living, and also social and social responsibility, meaning whether they will be able to interact and be part of a social community. Okay, so in order to survive in the society, the person will not just have to have adequate intellectual functioning, but also adequate adaptive functioning. So if it's an all-rounded deficit in both of these areas, then it will be the individual will qualify under intellectual disability as a whole. Okay. So now, the next one will be more specific learning disorders. This one will be more of difficulties in specific areas of learning and specific. The early one, intellectual disability, remember that is an overall deficit in general overall functioning. Okay. So in contrast, a specific learning disorder is whereby the child or the individual might not really have a general intellectual deficit, meaning in terms of IQ, there might not be a proper issue, a very big issue with it, and there might not be an issue with adaptive functioning. The child also will be able to take care of themselves, but there are more issues in more specific, more targeted areas of. This will also be significantly below that's expected of the child's age, and also affect academic performance. So an SLD, a specific learning disorder, is usually more noticeable when the individual maybe starts schooling, for example, or starts going to kindergarten, where you realize that generally the child is able to function overall, able to make friends, able to talk, able to listen to instructions, able to follow, but maybe there are certain difficulties in terms of reading. Okay, maybe only just reading. In terms of speech, they are fine. Okay, or they might have difficulties with just writing. Okay, so maybe they can read, but they are not able to write, construct sentences, spell words, for example. Okay, and then there might be problems with math as well. Okay, so for specific learning disorders, there are three main areas of difficulties in learning. Okay? Certain children might have only one impairment in reading and only one impairment in writing or in math, or they might have difficulties in more than one of these areas. Okay, so math would be more like difficulties, understanding the concept of numbers. Even so, all of these are even through repetition, even through guided learning or teaching, the child might still have difficulties. Okay, and it might seem like when they started schooling, they are far behind. Okay, in just these specific areas. Moving on, we have ADHD, attention deficit hyperactivity disorders. This one might be a more commonly known condition that all of us will just say, my child is very hyper, my child is like all over the place. So this is ADHD. Mainly there are issues in two main areas, which is the first one will be attention, and the other one will be hyperactivity, meaning the child's ability to regulate their energy levels, their activity levels. Okay. So in these areas, there are of course a lot of things to look out for. There's a lot, but I'll just quickly summarize. For inattention, mainly a child who has inattention issues might seem like they are always distracted, they cannot sustain their attention for very long, maybe for just 5 minutes or 10 minutes, then they might be running all over the place. Okay, or they might be daydreaming. Okay, there's poor attention to details. They might be always careless, missing a question here and there, missing a page. Okay, they might not be able to follow through with instructions. For example, if you give them an instruction with 5 things to do A, B, C, D, E, they might do A, they might do C, but they might not be able to complete everything because of the inattention at that moment. Okay, and they might not appear to be paying attention when you're talking. Then they might be yes, or they might be thinking about certain things. So that's a problem with attention, and because of that as well, they will. Children with inattention issues will have difficulties performing tasks that require more mental effort. For example, reading, writing, or more complicated mathematical questions or problem-solving questions. They might avoid all those things because it requires more time to think. It requires more effort to organize their thoughts. So a lot of children might avoid a lot of children with ADHD, it's very classic of them to avoid doing homework. Okay, if you let them do other things, if you let them play games, for example, you let them play puzzles, even puzzle pieces, okay, or other things, they might be, or watching TV, but they are able to concentrate for half an hour, 1 hour, 2 hours, no problem. But the thing is, it doesn't require that much effort from their end. So homework will be, compared to children who do not have inattention issues, doing homework might be, like the end of the world for them. Okay. And then they will have difficulties organizing their tasks. Maybe, for example, when teachers, have a homework list for them, they might need help, completing all those tasks, okay, or they cannot prioritize, they cannot do proper scheduling, okay. And then forgetfulness is very common as well. They might lose their homework, they might lose their books, lose their pencils, their erasers and things like that, okay. Hyperactivity. It's just, this one is, I think, more commonly understood, meaning a child is, might be, always running around, they might seem like they're always, like on a choo-choo train, they cannot stop, okay, even they might not need that much sleep, or, until very late at night also, they still seem to be very energetic. And mainly, the other thing is that when, it doesn't matter if they are that hyperactive, but the thing is that they do not know when to control that hyperactivity. For example, in class, or when parents are talking, they want to interrupt. When teachers are talking, they want to intrude. They want to, or they can't take turns. They want things to be done very quickly, okay? Or they will be very impatient, or they will talk or play very loudly. So basically, this hyperactivity, basically it's very common for children to be hyperactive, but whether to be very active, but to what extent is it hyper? It's when they are still unable to control themselves in situations where they need to. For example, in situations that require them to be quiet, but they're still playing very loudly, or they're very rude, or they're intrusive. Okay, for example, alright. So this is what ADHD is like, to provide a bigger picture of it. Okay. And there are 3 categories. So to have ADHD, certain children might just mainly have a predominantly attention problem, or they might not have so much of an attention problem, but more of just a hyperactive issue. And then there's the child who has a combined presentation of both attention issues and also hyperactivity. We'll move into the next disorder, which is also a big one, a very common disorder, a very common developmental disorder, but also to this day it seems like there should still be increased awareness to it, because sometimes parents might not realize it until a later age, where treatment intervention might be a little bit more difficult already. Okay, so mainly for autism, the deficits will lie in social interaction, social communication, and repetitive behaviors. I'll explain a little bit more on some examples to look out for. Okay, and also onset will be quite early as well. So do not hesitate if you're concerned. May be diagnosed as early as 2-year-old or 3-year-old. If symptoms are very, very clear, your child, you can get a diagnosis as early as 2 years old. If not, then sometimes we might need to observe and see until whether it still lasts or persists at 3 years old. Okay. Then it also ranges, it lies on a spectrum. As the name implies, it can be mild, it can be moderate, it can be severe. Milder cases might be looked because behaviors might not be, or the developmental delays might not be so obvious, okay? It might just surface later on as a personality or difficulties in interacting with people or friends. They might seem like they're always on their own, they cannot click with their friends, for example. often only be diagnosed in their teenage years or young adulthood, okay, when they start to realize that they cannot fit in, or they start to realize that, or parents or family members start to realize that certain behaviors are starting to look a little bit more odd, okay. So this one, there's an older term for it, which is Asperger's syndrome, but it all basically now falls under a big umbrella, which is the autism spectrum disorder. So milder cases, sometimes we still refer as Asperger's or for ease of explanation. Okay. For autism, certain more severe cases may be accompanied with intellectual impairment. So actually for autism, it doesn't necessarily mean that the child has an intellectual impairment. It doesn't mean that there's problem with their thinking, with their learning. Okay, it doesn't mean there's problem with their IQ or their self-care skills, for example, but maybe certain more severe conditions might be accompanied with it. Okay? First area of deficit, which is social and communication. Okay. So there will be very poor social awareness. For example, the child might always seem like they're in their own world or in their own bubble. They may feel like your child or your toddler might seem like they don't need to talk to other people. They don't need to reach out to other people. They are talking to themselves. They are playing with themselves, or they might start off playing with other kids, but then they end up just being alone. Okay, they might not be aware that there's a world outside of themselves. Okay, so because of that, they might have poor social skills. So even when they grow out of it, they are able to engage better. They might still have difficulties starting a conversation or getting to know a friend, getting to starting to initiate a certain interaction, or even reciprocating, meaning return it. Okay. For example, they might not be able to sustain lengthy conversations or conversations that go deeper than your usual, like how's the weather, or how are you today? And they might have difficulties with empathy, meaning they might not understand others' feelings, okay? And they might also have difficulties understanding and identifying their own emotion as well. So they might have troubles expressing their own emotions too. Okay, so for example, if they are upset or they are angry, your child might be throwing a very huge tantrum instead of actually voicing it out, voicing out certain things, saying, no, I don't like this or I don't like that. So they might not be able to understand that. So watch out for very big tantrums or unconsolable tantrums, meaning no matter how much we try to comfort your child, they still seem very upset, like the whole day, or throwing very, very big unreasonable tantrums, in public or at home. Okay, they have at a later age also, maybe they might have troubles understanding social cues. Okay, even maybe, for example, teenagers with Asperger's, for example, they at later ages, they might feel like, hey, how come I can't seem to fit in with my friends. I can't seem to find out, what to talk about. Like when they laugh, I don't feel like it's very funny, or it might feel like they are in a different channel. Okay, so this is also part of the social and communication deficit in someone who has autism. They might not understand when is it appropriate or inappropriate to hug someone. Okay, a child might be hugging everyone they see, even strangers. Okay, so be careful of that. Okay, they will prefer their own company. This will relate to being in their own world, and definitely sometimes the earliest signs will be delayed speech development. So normally when you consult your pediatrician, they might want to first of all rule out whether the child has an autism spectrum disorder. Okay, because sometimes when it's just a speech deficit, your child might still be able to engage well in non-verbal communication. For example, they will still be able to gesture to you to want something. They will still look at you when you're talking to them. It's just that they might not be speaking. But with autism, also watch out for if apart from the delayed speech development, there are also other things like, the poor social awareness. Okay. The mention it was that in line with the poor social awareness, there might be so they might all it falls in line with the being their own world. So when they are in their own world, they might you might need to call them for like 10 times before they finally react, and they finally turn around and look at you, or even if they look at you, so it's very fleeting, and then they'll go back to playing their own. Okay. In terms of restricted and repetitive behaviors, I'll explain some of the examples, because this one not a lot of us might be able to understand what it actually is. Okay, so when we're talking about this, watch out for stereotypic motor movements. For example, odd motor movements like lining up toys. Okay, for example, they will line up their toy cars in a very, very long line. But if you interrupt them, or if you try to ask them to keep it, or they will get very agitated, get very frustrated with it. Now they cannot take that change, okay? Or like spinning objects, they might be spinning the wheels on their toy cars, okay? Or they might be very fixated at watching cars on the road, the wheels turning, or even fans turning, okay? Then there will be echolalia. This will be a repetition in speech. For example, they might echo your last word in your sentence. Okay, for example, what do you want to eat? Burger. Then they might not respond, they might not look, but they will say burger, but they are playing with their own toys, for example. Okay. Then there will be idiosyncratic phrases, meaning non-meaningful phrases. You might not be able to understand what they're talking about. It might still be like in a babyish kind of speech stage where they're babbling, but it doesn't make sense. Okay? And walking on tiptoes is also part of the stereotypic motor movements as well. As I mentioned earlier, by around 1 to 2, when they have learned to walk, a child should know that they're supposed to walk on their heels rather than their tiptoes. Okay. Other examples of repetitive or purposeless motor movements are such as very strong body rocking movements. For example, they're sitting on a chair, but they might want to soothe themselves by rocking back and forth, okay, or head banging. When they are frustrated, they might be banging their heads on the floor, on the walls, okay, or against certain objects or certain things when they're frustrated, when they can't express themselves. Hand flapping, okay, so they might be flapping their hands. And self-biting is also sometimes a common self-harm repetitive motor movement as well. This is also often when they are unable to express themselves, when their speech is delayed, or when they are unable to identify why they feel that way. They can't, even if their speech also, sometimes they might have difficulties explaining why they feel this way. So head banging, self-biting, and maybe even some other self-harming behaviors might be present when they are frustrated. Okay, when you don't understand what they're talking about, they don't understand you. Okay, and then individuals with autism are very rigid. They are very fixated. They might want certain things to be arranged certain ways. They might want certain things to be arranged properly in a very neat and tidy way, or in a same kind of ways, in symmetry. They will be very inflexible to not just arrangements, but also how things are done, and also their routines. For example, every day they do certain things in the order of ABC, but if one day you because of situational circumstances, you might need to change it to A, C, B, but they might not be able to adapt to that. So children with autism will take longer to adapt to new environment. For example, when you send them to kindergarten or you send them to primary school, they'll take longer to adapt to changes in their routines. Okay. They'll have very rigid thought patterns. For example, if they think there's only one step to solving a problem, then you might feel like even if you suggest a different way, they feel no, that the only way is step A, okay? And they might also have certain very fixated interests. For example, they might only like toy animals, and then only a specific toy, for example, a toy cat, or they might like certain symbols or certain logos, okay? Odd fixated interests, okay? And lastly, and a child with autism spectrum disorder will also have sensory issues. If you look up here, remember the purposeless motor movements, the body rocking, the hand flapping, even the walking on tiptoes, all these are actually sensory issues. So for us, for example, when we feel like, okay, our body is aching, for example, we will just do common stretches, or if our fingers are aching, we will crack our knuckles, for example. But a child with autism might need a higher level of sensation in order for them to feel to let go of that tension. So that's why they might exhibit certain very very big movements like body rocking in order for them to feel a bit better, okay? Other hypersensitivities or hyposensitivities, meaning either very high tolerance or low tolerance to, for example, loud noises, for example, thunder, lightning, sirens, firecracker sounds, okay? All these, either they might be very hypersensitive to it because it might be 10 times or 100 times intolerable for them, okay? So some children with autism might tend to close their ears when even there's a very very not so disturbing sound to common people. For example, in a room, suddenly when the TV is turned out a bit too loud, you might notice they start to close their ears, okay? Textures of clothing, tags on certain clothes that's rougher in texture. So they might have certain habits where they only want to wear certain clothes, okay? Sensitivity to light or visual movements. Remember watching objects spinning, okay, or sensitive to really sharp lights. Excessive smelling, okay, or indifference to pain or temperatures. They might not know that when they've touched something hot, for example, that it has caused certain pain for them, okay? So this is a summary of what autism is like. I'm spending a little bit more time here because it still seems to be a lesser known issue among children, and really sometimes when brought into us, it's a little bit, the child is a little bit older, so and interventions might be a little bit more difficult, okay? And this is, again, these are just examples, and there might be other symptoms or other types of behaviors where a child might manifest that I've not listed here. Okay, so if you feel like it's off or it falls in line with some of these that I've mentioned, then please do not hesitate to seek out your doctor or your psychologist or your child psychiatrist to get an assessment done. Okay. Right. So moving on, some of the less common but also we still tend to see them sometimes are communication disorders, okay? One type of communication disorder is a language disorder. So again, this is a more specific deficit in just language. For example, the use of words, vocabulary, okay? Poor sentence structure, difficulties forming sentences to express themselves, poor sentence connection or thought organization. For example, you feel like you need to clarify multiple times in order for you to understand what they're talking about, their stories from school, what happened, it might be like jumbled up, head or tail of the sentences might be, inverted, okay? So this would just be language, okay? But when they are speaking in normal, more day-to-day sentences, they might not be an issue, but when they need to tell you lengthier stories, for example, then you should sense that it seems like there's a difficulty. And sometimes when communication or instructions are too complicated, then they might have difficulties understanding. So there's in terms of deficits in terms of comprehension. Okay, and we have another communication disorder, which is speech sound disorder. This one is when a child has difficulties making or forming sounds appropriately. Okay, for example, they might certain sounds, or S might be a sh, for example. So these kinds of problems, okay. Then we have the childhood onset fluency disorder. This one is more commonly known as stuttering, okay, meaning they are always, they might not be able to pronounce a word completely because it might be interrupted. For example, apple, apple, for example, okay, so it's stuttering. Then we have the last one that I'll be talking about will be motor disorders. Okay, this one is also less commonly seen but happens as well. Known as tic disorders. Okay, a tic is, by definition, is a sudden, very fast, very rapid, and also repetitive motor movements or vocalizations. So it can happen in terms of motor jerks, for example. They might be switching their, nodding their head to the side very rapidly in a very disproportionate kind of movement, very big movement, okay, that you feel like, how come they're doing it so repetitively? Okay, or if in terms of vocal tics, they might be uncontrollably blurting out certain terms or voices, that might seem like out of place, and it will seem like they cannot control themselves from blurting it out. For example, they but it keeps repeating it and repeating, and you will see that they can't control themselves from stopping it. Okay, so this one is more of in terms of a neurological motor condition. Okay, for example, Tourette's disorder. Okay, so Tourette's disorder will have a combination of I've covered some of the more commonly seen neurological disorders, and with hopes that this will awareness to how we can help our kids, or even our friends or people we know, relatives, family members, to identify whether our kids' developmental delays are actually significant, or can still continue to observe, whether it's still like, someday it will just take time to develop. So again, remember that these are just examples of symptoms and traits or behaviors, and there might be more that I've not covered. And remember, if you are not sure, bring them in to your pediatrician or your psychologist or your psychiatrist for an assessment. Okay, so I'll go ahead and talk about what types of assessments that we can normally do to identify what exactly is the issue, because sometimes a child might have a combination of different delays. For example, they might have intellectual delay and also an attention deficit, for example, or attention and ADHD, but also a combined specific learning disorder in reading, for example. Okay. So first of all, remember to just rule out visual problems, whether your child has a visual problem, they can't see, do they need glasses, okay? Rule out hearing impairments, bring our child for a hearing test, or even bring our child for a test to see whether they're colorblind, okay, just to rule out everything, okay? And rule out whether there are other neurological disorders, okay? Maybe underlying epilepsy, for example, might affect the child's functioning. And also consider whether the child's learning environment or family environment is actually affecting, for example, who are in constant neglect, or children who are in a family who speaks, more than 2 to 3 languages together. So they might take a little bit more time. So to figure out, their speech and language, okay? Or maybe children who are born in families or with parents or family backgrounds who, are already maybe deaf or mute, okay? So then when there's a lack of exposure, then the development might be delayed as well, okay? So 3 main areas to assess. We want to assess whether the development, general overall development, is the functioning is up to the ages, and whether behaviorally they're behaving normally or not. Okay. So in terms of cognitive functioning, there are overall intellectual functioning tests, or more commonly known as IQ tests. We will test for reasoning in terms of non-verbal or verbal reasoning, whether with or without speech and language abilities, they can function, they can think and learn properly. There'll be visual reasoning, visual spatial skills as well. And then we have under cognitive functioning, we also, in terms of we're testing for IQ, for example, we also want to test for their attention, their memory, how fast they process new information, processing speed. And executive functioning is the ability to plan, to organize information, to make decisions, to solve problems, okay? And then when that is ruled out, normally if, when, say, for example, teachers report that, this child has reported to parents that your child seems to have a learning delay, but sometimes, teachers or parents might not know what actually is that delay, okay? So we will need to do a complete IQ test, rule out whether, in terms of general thinking and learning, whether they are functioning well. Okay, if that is okay, then we will need to assess their attention, whether is it because of the attention problem, so do they have ADHD? And if all that is resolved, whether they only just maybe have specific learning disorders, which is more evident in terms of academic functioning. So you will see that maybe just language subjects, they are very, very, very poor at language subjects, but in terms of maybe math, they're doing very well. But maybe because of poor language understanding, their math might be impacted as well. For example, they can perform very well in normal equations, or they can memorize times tables very well. But when it comes to problem-solving questions, when there are lengthy instructions in language, sentences, then when they might not understand that, then they won't be able to perform well in math as well. Okay, so basically, in terms of cognitive functioning, there's a lot to assess for. That's why in assessments, there will be multiple tests that will need to be done to ultimately figure out what exactly is the problem. Okay, so we need to rule out whether if it's just an overall intellectual disability, or actually no, it's just different areas or just attention. In terms of developmental functioning, this is just an overall view to see whether how, in these main 4 areas, in terms of speech, communication, daily living skills, social skills, and motor skills, whether they are up to the age levels. For example, when your child is 5 years old, is their language ability up to 5 years old? Are they able to talk in sentences? Are they able to talk and explain in lengthy sentences? Okay, and by, for example, 8 years old, are they able to take care of themselves? Are they able to identify at least bank money notes or coins? Okay, or purchase stationery in school? Are they able to function in the community and understand that they need to participate in, for example, in class, they will need to take turns to perform school classroom chores, sweeping the floor, for example, or collecting books on behalf of their fellow students, or domestic chores also, whether by a certain age they're able to help out at home. Okay, social skills also, whether by 5 years old or 4 years old, are they able to play well? Okay, are they able to play, for example, hide and seek with with other kids? Are they able to play, maybe by school age, are they able to play board games? Okay, so you will see different functioning at different ages. So, but have they met these milestones? Okay, so this is what the developmental functioning will assess. Motor skills, growth and fine. Growth will mean more simpler movements like running, walking, jumping. These are gross motor skills. Fine motor skills are, for example, like writing, holding a pencil, or using a scissor to cut paper, drawing a straight line with a ruler. Okay, so these are our fine motor skills. So we will assess whether your child has reached that age for that milestone. Okay. The last area to assess will be the behaviors. Okay, this will mainly be more for autism. Okay, and also hyperactivity as well. So you want to see whether they have, they are presented, they present with stereotypic behaviors, like toys or other motor, repetitive motor movements. Okay, and hyperactivity, whether parents and teachers have noted, all the traits of hyperactivity that I've mentioned earlier. Okay, right. So these are some to give an idea to all of us out there that assessments are readily available. Just don't be afraid to seek out an assessment, just to make sure that nothing is too big of an issue, or if there's an issue, we can figure it out. So then we'll talk about the last part of today's sharing, which will be interventions. Okay, interventions will mean what kinds of treatment are available now. Okay, what kinds of therapy or what kinds of things that even as parents or family members you can help out your child, or you can do at home and practice at home. Okay. So first of all, I'll talk about primarily for ADHD, especially if the hyperactivity is more severe. Okay, where your child really cannot regulate themselves in class, for example, and they're disruptors and they're not following instructions. So this is when hyperactivity affects your child's learning. Okay, so there's medication available. Okay, these kinds of medications are actually in the category called stimulants, which is the same kind of category as coffee. Okay, caffeine. So adults, it's similar as how adults will need a caffeine kick, okay, or a cup of coffee in the morning to start our day. Okay, or sometimes in the middle of the day we will need something to boost an energy boost, or a mental boost. Okay, so stimulants for children with ADHD is actually similar, but it's constructed in dosages that are very, very small and very suitable and not harmful for young kids. Okay, and doctors will also only prescribe very small dosages for children. Okay, so it's similar to how adults need coffee. Maybe children with ADHD, they will need a certain boost as well. So when taken in the morning before going to school, for example, it might last them a few hours and it might help them to be calmer, to be more self-regulated, and to be able to pay attention a little bit longer than without medication. So in that sense, they can function better in class, they can normalize better in class, they might not be as disruptive. Okay. Then there might be other psychotropic medications for mood or behavioral symptoms. I won't go too much into this, but this is more mainly if, for example, as a teenager with autism, when they start realizing they can't with school friends, maybe if when they start being a bit more anxious or depressed or stressed out, then there are medications for that. And if there are certain behavioral aggression that becomes uncontrollable, there are medications for that to help out as well. Okay, but I won't be going too much into that. It will be too technical already. Okay. Speech therapy. therapy available. Okay, so if you notice that your child has speech delays, for example, an autism, or if it's just a simple speech delay, or if it's just a simple communication disorder, the stuttering, or if it's speech sound pronunciation, then go for speech therapy. Start speech therapy to teach your child to articulate properly, speak properly, to be more fluent in their speech, more fluent in their language as well. And also sometimes a child might have difficulties using their mouth muscles or their tongue to make sounds. Okay, speech therapy might also help with that. And also feeding and swallowing movement. This is speech therapy. So if you have went through an assessment and you've wrote out other issues, and maybe your child has been diagnosed with autism, there's a speech delay, no other issues, no autism whatsoever, then you can start speech therapy to target all these issues. And there is occupational therapy, which is mainly a form of therapy that uses play methods to help your child with their play skills. For example, a child with autism, when they're mainly just playing with themselves. So with occupational therapy, they will be exposed to methods of playing with other people, other kids. Skills, sensory integration. This will help to regulate their senses, to maybe use other forms of methods through play to release certain sensory tension. So to normalize for example, rocking or flapping, okay, or attention as well. There's attention training, okay, in play that can be done. Sometimes we can also teach them daily self-care skills, how to dress up, how to zip, how to button, okay, motor skills as well. And then when your child is playing with toys, there will be a lot of exposure to more targeted motor deficits that your child. So if it's just holding a pencil, okay, maybe there will be techniques and therapy to help them to be more used to using their fingers or their hands to use to the pressure of moving their fingers or their hands to do certain things. Okay. Are learning interventions, okay, whereby individualized education plans will be put in place. Okay, this will be targeted learning plans that is devised based on your child's different needs and levels. Okay, so for example, after your child, if your child has been diagnosed with ADHD, okay, then if you have been referred to a certain special needs learning center, okay, then there will be assessments that can be done to assess, okay, where's your child's learning level at this point. Okay, for example, if they are 6 years old, but maybe they are still at 4 years old of learning stage. Okay, so then we will need to go back to their level to teach them. Okay, so there'll be holistic interventions on learning, cognition, their social skills, and also behavioural training. Okay, so this might include maybe even speech therapy, therapy, and also one-to-one learning. Okay, so this is something where it includes everything under one umbrella. Okay, and I'll talk about vocational training as well. So this is mainly for children who might still be struggling with learning or academic skills at a later age. For example, when they're teenage years, okay, when you feel like they're still struggling, okay, but in terms of self-care skills or normal daily life skills, okay, they're actually very good at that, then maybe it will be better to send the child for vocational training or vocational school. Okay, this will foster better occupational independence in the near future. When, for example, when they graduate from secondary school, what are they going to do? Okay, they can't read, for example, then, but that's fine. If they can do other things well, then it's totally fine. There's a lot of techniques and training that they can do, other skills. For example, wiring, mechanics, cooking, hairdressing, and etc. There's a lot more out there. So we try not to limit our children to only certain options. But even if they're not interested, it's fine. They can pursue other areas of learning, other skills. Okay, so as long as they can still be occupationally independent, they can take. That's the ultimate goal. Okay. Mentions in terms of parenting, I'll just introduce because this I have mainly discussed in length in the previous session 2 weeks ago. So feel free to scroll down a little bit more on our Bagan's Center's Facebook page, and just if you're interested to check out what you can do in terms of parenting, how to parent positively, and how to manage your children's behavior. For example, if your children has hyperactivity or your children has autism, then there's difficulties managing and communicating their behaviors. Okay, so this is where all these parenting interventions will come into play. So feel free to scroll back and look back if you're interested and figure out. Also, do not limit social exposure. This is similar for any other child. It doesn't matter whether your child has difficulties or no difficulties. Do not limit social exposure. Okay, send your child to kindergarten at 3 or 4 years old. Okay, even if it's the kindergarten at an earlier age, they don't necessarily focus on academic learning. More on exposing your child to learn how to adapt and play with other kids, and to get to know new people, to learn social rules. What are they supposed to do? They're supposed to queue up, they're supposed to take turns, they're supposed to be kind to their friends, for example. Okay? If your child has difficulty socializing, for example, children with autism, so don't worry, start from young. Spend time, mingling, setting up play dates with your friends' children or other kids, or sign up for music classes, group music classes. There are a lot of toddler music classes out there these days in music schools where parents can join in along and sing along to songs or play little musical instruments. Even dance classes, drama classes, storytelling. All these are social activities that you can actually it's at home on your own, or if you're not sure, then you can sign up for classes outside, and then then learn certain ways. And if you have your child has other siblings, then you can even conduct it at home. Okay, or you have spend time with children from other relatives as well. Just keep them exposed so that and do not give up, even though maybe at 3 years old a child of autism might not be interacting. So guide them and be with them, create a safe environment and controlled environment for them to wander around, to be safe, and to play with kids without feeling afraid that they will make mistakes. Okay, but don't give up on that. And maybe at 3 years old, for a few months you might not see any difference, but maybe just keep trying. Maybe at 4 or 5 years old they will start to play more with other kids. They will engage more. When they realize that when the outside world is actually quite interesting as well, they will walk out of their own bubble. Okay, and the thing that I wanna always emphasize is early intervention, meaning start early, no matter how early it is. For example, if you've already noticed certain delays at 2 years old, so do not hesitate to speak to your doctor or get your child assessed. Okay, because it's better to find out early, to figure out early, and to start a treatment early than later. Okay, because there are better chances of your child being able to normalize in school. For example, when they are at 6 or 7, they might be able to engage better and develop faster, or more in line of their ages, where by the time, for example, when they are 6, how much they should have developed. So if we start early, they will develop fast, they will develop further. Okay. compared to when they're already at school and we can't say it's never too late, but it'll be more difficult by the time it's later. Okay, so remember, early intervention. Okay, so start early and do not hesitate to seek help. Okay, right. So with that, I will just summarize and end today's session. It's again quite a technical one, and it's quite a heavy topic also. But it was I will try my best to summarize as much as I can on certain signs and symptoms for us to look. And also the treatment and interventions that are available, the assessments and testings that are available. So don't worry, don't panic, and don't be afraid. At this time, in this century, there are a lot of things that you can do and that's easily available to help you out and to help your child out. Okay, and as this quote here that I'm going to end with. Is that if a child doesn't learn the way they're supposed to, that we think society says they're supposed to, they don't learn the way that we normally teach them to, it's fine. Okay, sometimes we can try to adapt to them. If they can't adapt to us as parents, as families, as teachers, then we try to be more flexible and teach them the way that they can learn. So sometimes when we just change a little bit, they can learn better. And when they learn better, and when they pick up, once they pick up, you'll be amazed at how fast they can improve. Sometimes you'll be amazed at how fast when a child, when they, that switch is flipped on, you'll be amazed by how fast they can pick up. And when that happens, then you might not need to be as worried anymore. Okay, so again, remember to start early. All right, then. If we start earlier, then there's a better prognosis. Okay, but again, do not worry. All right. So I'll end today's sharing here, and these are my hours and my clinic hours and my contact. If you feel you have questions, you can feel free to comment down there in the message pane in today's webinar, today's video. But otherwise, if you feel like you need a more personal session, then feel free to contact me and set up an appointment. If you just have a quick question, you can shoot an email to me as well. That's totally fine. Okay, and we'll see how we can go about it. Okay, so thank you very much for your time today and Saturday evening. But I hope it was informative and it was helpful. So I'll pass back to the time back to our coordinator, Mr. Yap, today. Just end today's session. Thank you very much.
Thank you, Ms. Kang, for the sharing. With that said, thank you all for watching, and have a nice day.